Over the past year, we've developed a Foregut program, which is unique within Western Michigan, and this allows patients with conditions of the upper gastrointestinal tract to be treated by a multidisciplinary team of physicians as well as social support. The benefit to the patients that this Foregut program provides is that they get in to have their diagnosis sooner, as well as getting the treatment that they need done in a timely fashion. Throughout the process, they also have the support of social workers and nurses who are specifically trained in these areas to help them not only deal with the surgery itself, but the other impacts that it may be having on their life. I developed an interest in treating patients with cancers based on the area of the body that I like to treat, being the upper gastrointestinal tract. And there are a lot of benign conditions in that area, as well as multiple cancers. The patients that we see that end up having a cancer are typically treated initially with surgery, unless they've already been seen by a radiation or a medical oncologist for their specific tumor. But once they have surgery, we continue that care, and we have a multi-specialty conference. Amongst the different disciplines, we discuss the patients and what treatment is appropriate to that specific patient. I have a primary interest actually in doing as many cases as I can minimally invasively, which means using small incisions and laparoscopic instruments, as well as the robot to do the majority of my cases. If there is a specific patient condition that is not conducive to doing a minimally invasive procedure, then if need be, I do open surgery as well, where we make a large incision, and most of it is tailored to the specific patient. Patients who undergo minimally invasive surgery have a quicker recovery because they end up with smaller incisions, which leads to less pain postoperatively. I have almost a need to get up in the morning to get to work to take care of my patients and to make them feel better. I think that's the major driving factor for me, is that I can, within potentially in even a half an hour, give them a much better lifestyle than they've been having, as patients often suffer with their surgical problems for many months before coming in to get their surgery done.